The consequences of neglecting diabetes management. Diabetes affects millions globally, and its management requires a multifaceted approach that combines lifestyle changes, medications, and, in some cases, cutting-edge therapies. The primary goal is to maintain blood sugar within a healthy range to prevent both short-term and long-term complications. Let's begin with current treatments and emerging advances. For individuals with type 1 diabetes, insulin therapy is indispensable. Because their bodies do not produce insulin, patients rely on injections or insulin pumps to regulate their blood sugar. Recently, innovations like closed-loop insulin pumps have emerged. These systems, often referred to as artificial pancreases, automatically adjust insulin delivery based on real-time blood sugar readings. Additionally, researchers are exploring beta cell transplantation and gene therapy, which hold promise for offering a cure someday. When it comes to type 2 diabetes, the initial focus is on lifestyle modifications, adopting a healthy diet, exercising regularly, and maintaining an optimal weight. If these changes prove insufficient, medications such as metformin are typically introduced to improve insulin sensitivity. Beyond metformin, newer drug classes like GLP-1 receptor agonists and SGLT2 inhibitors not only help control blood sugar, but also provide cardiovascular and kidney benefits. A recent development is tirzepatide, which has garnered attention for its dual action on blood sugar regulation and weight loss, making it a promising option for many patients. One of the most exciting breakthroughs in diabetes care is the advancement in stem cell therapy. Scientists are working on lab-grown beta cells that can produce insulin, potentially offering a long-term treatment solution or even a cure. Although these approaches are still experimental, they represent a beacon of hope for the future of diabetes management. Now, let's discuss the complications associated with diabetes, which can be broadly categorized as short-term and long-term issues. Short-term complications. Hypoglycemia, low blood sugar. This occurs when blood sugar drops below 70 milligrams per deciliter, often due to missed meals, excessive insulin, or unplanned strenuous activity. Symptoms include dizziness, sweating, shaking, and confusion. If left untreated, severe hypoglycemia can lead to loss of consciousness or seizures. Diabetic ketoacidosis, DKA. Predominantly seen in type 1 diabetes, DKA happens when insufficient insulin forces the body to break down fat for energy, producing ketones that can acidify the blood. Signs include nausea, vomiting, rapid breathing, and in extreme cases, coma. Immediate medical care is essential. Hyperosmolar hyperglycemic state, HHS. More common in type 2 diabetes, HHS is characterized by extremely high blood sugar levels, often exceeding 600 milligrams per deciliter, and severe dehydration. Without ketone formation, symptoms such as confusion, seizures, and coma can still develop rapidly if treatment is delayed. Long-term complications. Diabetic neuropathy. Persistently high blood sugar can damage nerves, especially in the extremities, leading to numbness, tingling, or burning pain. This nerve damage may cause minor injuries to go unnoticed, increasing the risk of infections and even amputations. Diabetic retinopathy. Damage to the small blood vessels in the retina can gradually impair vision and may eventually lead to blindness. Early stages often present no symptoms, which makes regular eye exams crucial. Diabetic nephropathy. Over time, uncontrolled blood sugar can harm the kidney's filtering capabilities, potentially leading to kidney failure and necessitating dialysis or a transplant. Early indicators include the presence of protein in the urine. Cardiovascular diseases. Diabetes significantly elevates the risk of high blood pressure, high cholesterol, and arterial blockages, which can result in heart attacks, strokes, and other circulatory issues. Foot complications. Poor blood circulation and nerve damage make the feet particularly vulnerable. A minor cut can escalate into a severe infection, sometimes leading to gangrene or amputation. Regular foot care and medical checkups are essential to prevent these outcomes. The encouraging news is that many of these complications can be prevented. Effective management of diabetes involves maintaining blood sugar levels through medication, diet, and exercise, as well as regular medical evaluations. Routine checkups, including eye exams and foot examinations, help catch early signs of complications before they become serious. While diabetes remains a lifelong condition, advancements in treatments and preventive care are steadily improving quality of life. With ongoing research and a proactive approach to management, the future of diabetes care looks increasingly promising. Always consult with your healthcare provider for personalized advice, and remember that prevention is the best strategy for managing diabetes and its complications.